Erectile dysfunction is the consistent inability to achieve or maintain an erection. Erectile dysfunction is fairly common and affects approximately 1 in 4 men in the United States. That's approximately 30 million men. I do believe it's significantly underreported, as this is something that we don't talk very much about as men. There are many causes of erectile dysfunction. The most common in the United States today happen to be secondary to cardiovascular disease, smoking, diabetes, and high blood pressure. We oftentimes ask patients about these things when we see them in primary care appointments as physicians. When I am sent these patients, it is generally speaking an opportunity to ask about their heart risks as well. Erectile dysfunction is often diagnosed simply with a history and physical exam. There is not a whole lot of invasive testing or any other things that are involved in it, so it is fairly straightforward to simply go and be evaluated and have the diagnosis of erectile dysfunction. Erectile dysfunction can be prevented by avoiding some of the general problems of our population, such as smoking, alcoholism, diabetes, high blood pressure. These are all things that contribute significantly to erectile dysfunction, and if you are trying to improve your opportunities of not getting them, taking care of yourself is the primary goal. If you are a smoker, smoking cessation would be a #1 priority, as it contributes to high blood pressure and overall cardiovascular disease. Otherwise, there are certain medications that may also be the cause of erectile dysfunction that can be discussed with at a visit. The main benefit of seeing a specialist in erectile dysfunction is that we offer many treatments that may not be available from your general practitioner. Most general practitioners are only comfortable providing medications and then will send to us, and we have multiple other treatment options that we can provide. Erectile dysfunction has many different treatment options. One of the first things that we suggest to a man is optimizing their medical health. If this is not helpful, then we do generally start with medications that are in the phosphodiesterase 5 category. The sildenafil, tadalafil are both generics that are now available and easily acquired. Beyond that, if the medications do not work, we do talk about options such as a vacuum erection device, penile injection therapy, penile insertables such as Trimix gel, and also we discuss penile procedures such as the prosthesis. At a consultation, we will determine what treatment is right for you. The way we do that is a history and physical exam, trying to really get to know you as an individual, and then we'll make a decision based on what your prior experiences are, what your options would be going forward. We often tailor them based on your prior experiences and then your future desires once you have heard all of your options. Satisfaction rates of the different treatments for erectile dysfunction do vary based on the individual and where they are in their pathway. Men who are able to effectively use pills without any significant side effects are quite satisfied, but as they wear off and the effectiveness wears off, moving down the line, there may be some satisfaction with different treatment options. In general, most men find the most satisfaction with whatever is best treating their erectile dysfunction. If other treatment options are variable in their success, then men generally find satisfaction best with the penile prosthesis, as it is on demand and generally does not fail the individual. There are long-term consequences of not having erections for several years. Generally speaking, what happens is scar tissue builds within the inside of the penis. This shortens the penis and does not allow for good erections in the future, even with some of the medical management that we have. This is something that if we can deal with the erection sooner, you may be able to prevent.